So we're sitting here today with Dr. Angela Gichaga, who is the founding CEO of Financing Alliance for Health, and who over the last 9 years has built this amazing body of work that is Financing Alliance for Health as we know it today. Angela, thank you so much for giving us this opportunity to ask you a few questions, even as you prepare for your transition and hand over to Soleine and I. The first question is, looking back over the 9 years and looking back at all the great work that you have done, what achievement are you most proud of and why does it stand out to you?
Wow, it's hard to identify just one over the 9 years, but I think about our progress so far in kind of 4 Ps. I would say the first one is purpose, the second one is people, the third one is progress, and the fourth one is partnerships. And the first one around purpose and the fact that we had such a purpose-driven vision. 9 years ago, the thinking was, and what we were building and co-building with the rest of the team was how do we actually serve our communities and serve our communities through governments and making sure that governments are, stewards of health financing and playing their role as convener, co-funder, coordinator, co-mobilizer of HR, but also this reality around making sure that the governments were the ones coordinating how funding was coming into their own countries because they're being held accountable for the health impact. And so how we could make sure that all partners who are coming to accompany governments on their journey were funding government identified priorities as well. So now with the current changing landscape, everyone is talking about the future of global health funding is domestic. We have been working on that since inception. We were always working on that. So in as much as how we have carried out our vision is very different, but we've always stayed on vision and our vision has not changed. We were created as a health financing institution to help in domestic resource mobilization as well as innovative financing. That's what we were doing in day one. It's what we have been doing. Even today, we keep doing that. The how and the solutions and the service packages we offer continue to evolve. But again, who we are and the vision we had is we are stubborn on vision and we've remained constant. So that's on purpose. The second one is on people. And again, from day one, the goal was always to build a team that is reflective of the communities that we serve, and the fact that we really wanted to make sure that we can, and I keep quoting Carl, we can remain locally rooted but globally connected. And this idea of our team to be able to reflect those populations was making sure that we were predominantly from the continent, predominantly women because the continent is predominantly women, that we were predominantly young because the continent is predominantly young. And the idea that there is value in lived experience and there is value in us bringing that lived experience to shape the policies that will affect us. But also the fact that it was the fact that the people who would form part of the team would live the consequences of the actions or inactions that we take. If we are successful, we will be here and the next generations will be here and live the consequences of those actions. If we are ineffective as well, we would bear the burden of the consequences of those actions. And we have had such a fantastic group of people who've walked through the doors of FAH. I think over 120 people have come through as team members, as fellows, and skill sets everywhere from public health to health financing to investment bankers, and to have fantastic people coming in to help us deliver on the vision and on our purpose. And that for me, the people has and continues to be our most valuable asset because that is what we offer the landscape. The talent, the skills mix is what we are offering to the ecosystem. The third one is the progress, and I mean it's the money we've influenced and directly moved. It's the community health workers that we've contributed to them having roles and being paid. It's the people who we have upskilled in the ecosystem. It's us, the external impact. So the money moved around $38.2 million on budget, about $5+ $100 million in terms of influence. in terms of the community health workers, the ones we have touched directly and indirectly, almost 500,000 community health workers. And then, of course, the 5,000 plus people who we've upskilled and grown their skill sets in health financing and health investments more broadly. That's the external impact. But also internally, I'm so proud of the progress we've made as building an entity, right? And an entity that is strong with systems, processes, with people, and an entity that can now have other entities under it. I think that has been really, I'm really, really proud of that and what we've built with the rest of the team. The last one would be probably partnerships. And this is where in all these areas, there's room for improvement. But the name Alliance is in our name, Financing Alliance for Health. We are formed by partnership, and how we work is through partnerships. We partner with governments and we partner with other stakeholders in the space. And we've had very great partnerships that we've been able to be part of in the first 5 years, 9 years of existence. Everything from the Africa Frontline First, which is a great partnership, the community health units for UHC, which is a great partnership. And partnership will continue to be such a core part of who we and how we evolve as an entity. So if you ask me, what I'm proud of, there are many things under that, but I think those 4 Ps kind of summarize the breadth of what makes me look back and smile more than not smile over the last 9 years. Thank you, Angela.
Mm-hmm.
Thank you so much, Angela. And more broadly, thank you, because we are so grateful for the work that you've done. I think the dream of any good leader is to create something that is going to outlive their tenure. And you have done that beautifully in being the founding CEO for FAH and then growing this team. And we now take it upon our shoulders to continue that mission. My next question is actually to learn from you. What do you think is most critical for FAH to carry forward? And why will that be critical in FAH continuing its mission?
Yeah. And that's a very good question. Thank you so much, Soleine. And for me, we've just been talking right now around change and being constant, and the fact that there are factors that are in our control and others that are out of our control that we can have influence or have concern over. I'm stubborn on vision, but I'm flexible on how we get there. And for me, the vision and why we were built, the values and principles of FAH are what I hope that will be carried forward. The landscape is changing, and we as an entity need to continue changing and evolving with how the landscape is changing. But I do think that the values and principles are so core to our DNA that would be great to make sure that whatever we do, we are holding it against those values. Is respect at the basis of our relationships? Is trust and respect? Are we disrupting status quo, not just to be disruptive, but are we disrupting it for impact and to actually make sure we are driving change? Like those values, should guide on what we prioritize, should guide on how we engage governments and partners, should guide on how we choose partners who are values and principles aligned. So, we will have to change as the landscape changes, and the entity will have to continue growing and evolving. But I do think that our values and principles are a core part of our DNA.
Angela, the word partnership keeps jumping out in everything that you say. Why are partnerships so important and central to the way FAH works? And how do we continue to further strengthen the partnerships that we currently have, even as we develop new ones?
Yeah, I keep talking about partnerships, and I think about it in 3 folds. The first one is that we are system orchestrators. And if you think about an analogy for systems orchestrators, we are relay runners, okay? And our role is the run is long, and our role as relay runners in systems change is to, get the baton, run our portion of the race very well, and then they pass the baton to someone else. And so the order of magnitude of challenge we have chosen to tackle is very large, and it's much larger than any one entity that can address. And so this idea around the fact that we need to be able to identify who in the ecosystem we need to be working together with so that we can play our part really well. And then we are able to rely on them to play their part really well so that we can see the impact that we want to have. So partnership is so key because it's not a marathon. It's not about, and it's ironic that, I'm Kenyan and headquarters in Kenya, and I'm talking about us not being a marathon, but it's not about just one person running the race and standing on the podium and holding the medal. As in systems change is really around that relay race. The second is really around this idea that even in our fourth objective of our strategy is ecosystems building, and this idea that again we want to have health impact, but we don't do service delivery in terms of health service delivery. Our role is to make sure that the resources are available, but we need to follow the money to impact. But to have that impact, we are relying on so many other people in the ecosystem to help us be able to link the money that we are focusing to the health impact and outcomes that we want to have in the field. So again, we won't get the health outcomes on our own. It's about making sure that we are working well with partners. And the third thing is really, again, true to who we are and the culture and our context is there's nothing like it's about we the people, we the community, we the continent are moving towards development. And again, Financing Alliance for Health, we work in the health space, we work on financing. But the way we frame our financing is not just about health service delivery. We've always talked about the fact that what we do is around economic development. It's about social, cultural, and social justice and social equity elements. And so, again, it's a much bigger lens than just thinking about health as a sector on its own. And again, because there's this intersectionality of how we work, we will be relying on others to partner to be able to get that bigger picture and make the bigger complex investment case more impactful.
Maybe just to say thank you so much, Asante Sana, for the beautiful work that you've done. And we look forward to continuing on that mission, those values that are so critical to the people that we serve.
Yeah, thank you so much, Angela, for your time and for your grace, even in sharing, these really insightful conversations with us. And we really want to wish you all the best moving forward. Thank you.
And thank you too for stepping up and accepting the opportunity to take on this new chapter and to navigate this new phase of FAH's journey. And I wish you all the best. And again, I have so much confidence in your co-leadership of the Financing Alliance for Health. I know that the entity is in great hands, and I look forward to reading and championing and liking all the posts of our continued impact and progress going forward.